Well, hello, everyone. Thanks for joining the regulatory roundup. I'm not in my usual location, so the camera's way up here and I have to read my screen. Um, but I wanted to talk this morning, both some federal as well as state regulations. And it's kind of a packed agenda. And I also want to touch upon the Office of Management and Budget. They had a request for information. It was due on Monday, and we submitted formal comments. It was very detailed, so I'll go over that a little bit with you. But also, so you know that it will be an update, a copy of it. I think it was almost 13 pages long. It took a long time to compile, so we can talk about that a little bit. Let me see. As usual, I wanted to talk about our survey findings. Um, I've been hearing from some agencies, they're getting their regular survey visits from DPH and accrediting organizations. And the focus seems to be a little bit different, depending upon the surveyor, of course. And also MassHealth, I'm hearing that MassHealth is doing on-site visits again, as well as some medical review. So for home health, and I want people to share, so open up your lines. I wanted people to know that I've been hearing some citations have been for incomplete plans of care, meaning, there wasn't interventions with ED visits or readmission risks were there, and there was no intervention regarding that. As always, frequent visit frequency is not matching our orders. It's really quite problematic. And home health aide supervision deficiencies, we've been having that as long as I can remember. Regarding the accrediting organizations, I've heard from two agencies, and earlier this month I had a QI and clinical directors meeting, and one agency had a joint commission survey that they were telling me was extremely lengthy. It was so lengthy that they called the joint commission and asked it to be stopped. It was, I guess it was pretty bad. And I'm not sure if that member is on the call right now, but she can chime in. And then for hospice, I haven't heard too much from hospice. Really, the last thing that I was hearing was they seem to be focusing on the volunteers. And then finally, MassHealth, and I do want to point this out. MassHealth has been active. I've been hearing from a lot of home health agencies when they're looking at medical record review. They're looking for verbal orders. Verbal orders has always been an issue. They want to make sure that the doctor called before you started the visit and that verbal order is documented. Signed plans of care. Some agencies had a few plans of care that weren't signed timely to what their billing was. I think it was 90 days after billing, the physician still hadn't signed. So MassHealth is a bit different from Medicare. As you know, Medicare, you have to have it signed before you can send your claim in. And then the other thing I want to point out, because I heard from another agency just last week, and they were sanctioned for missing member connection forms. So as you recall, the member connection form, and oh, by the way, Cynthia will give you this presentation with the recording. The member connection form, I still think of it in my head as the ASAP form, the old ASAP form. So basically, when you think that a MassHealth patient needs ASAP services, you would refer them to the ASAP using this form. So just for some guidance, if you ask the patient in the beginning of care if they wanted ASAP services and they declined, you need to document that. You can put the form in there and just say that they declined. Or if the patient already had ASAP services, make sure you document that in the chat, because that's why you didn't refer them. And then I think the other thing that might be catching people is the regulation is like either you refer at the start of care or at least 15 days before discharge. So if you had a patient in the beginning of care and they didn't want the ASAP services, It is required that you ask them again before you end services, at least 15 days before. And document that if they didn't want it or not. Let me just see what's in the chat here. Let's see, question for the group. Does anyone have someone that's recommended for certified electronic health records specialist training? So if you do, you can put that in the chat. Let me see. Anybody on the call, you'd have to unmute yourself. Anyone on the call had a recent either DPH, accrediting organization, MassHealth audit that they'd like to talk about or tell us about? No? Okay. Yeah, maybe no one's on the phone right now. But I did hear, as I said, about those accrediting bodies, you know, and when you get a survey, if you're not, I think I've said this before, but if you're not comfortable with the surveyor is saying, you know, always ask them to show you the regulation. You know, where is this? I'm not, you know, I don't know where this can be found. Call me, call the Home Care Alliance if you need some assistance. Because sometimes the surveyors are not necessarily really familiar with home care and they can easily make a mistake. Okay, next. Whoops. So this is the Office of Management and Budget. They sent this in April, so I didn't even come across my desk till I think last week, the beginning of last week. And the Office of Management and Budget is asking for requests for information about deregulation of any federal regulation. It just didn't have to be from CMS. It could have been from OSHA, any federal regulation that you had. So we asked members for help, and unfortunately, I didn't get that message to you till Friday. And so really, I needed them Monday or Tuesday. Because it was very in-depth. So we submitted 13 pages of comments. I'll go over those in a second. And there were some comments I actually didn't get to, but we will bring those forward because now in June, CMS through the Health and Human Services has a request for information again. So this is called Unleashing Prosperity Through Deregulation of Medicare Programs. So this is Medicare specific for home health, hospice, all providers. This is due June 10th. So in update today, I probably put another little article in with my email asking you also to comment on that. I still have the comments from the one that we just submitted. So those are still probably going to continue with the ones that are Medicare specific. So I just wanted to highlight a few things that we commented on. And again, thank you for everyone. You had some really good comments. I do want to say that the regulation, the request for information was regulatory only, not statutory. So EVV is statutory, so they're not going to really look at it, but we commented anyway. Because we commented on, we realized that it's statutory and maybe the government has to do it, or it does. But we commented on the burden that it is for providers. We have that, you know, it's an administrative burden for your overhead, your staffing impact. And we're hearing from agencies, they have to hire more administrative staff, the burden of correcting all of the issues, and then the cost of the alt EVV if you have a different medical record, and then you have maybe had to purchase that, or your vendor limitations, the limitations that the workarounds that you're doing, again, more of a financial burden. And then the technology, geographic issues that we're having. So we made some lengthy comments on that. Um, Face-to-face, again, this is statutory, but we put it in anyway. And while we were at it, I asked to extend telehealth. And the comments for face-to-face really, we know it has to happen. It's program integrity. However, the prescriptive documentation that we need and, dot all the i's, cross all the t's, asking a physician for this, chasing them. This is a burden for us when it isn't even our documentation. So we commented all about that. And we also commented that, just to make it easier on the patient as well as the physician, we appreciated that they extended the telehealth. And I shouldn't say extend, we actually asked it to be permanent in our comments. What else was I going to say about that? Oh, and what our recommendation was, we recommended that the face-to-face date just be put on the plan of care in the certification statement. The physician's attesting to it with a date, that should be good enough. Or it's somewhere in the plan of care. I didn't specify where in the plan of care. OT is a qualifying discipline. Again, this is statutory, but we put the comment in because of the staffing shortage for nurses. CMS is really, I don't want to say hounding, but not getting in to see a patient timely. Patients are in the hospital. We can't get patients out of the hospital, and OT may be the primary discipline if it's functional, if they're having problems with their ADLs or maybe some sort of assistive device. There may not be a need for nursing or for PT. So we documented that as well. Therapy to admit your nursing case, as we had in the, it was an allowance during the COVID. We asked them to reinstate that. This one I did put in, this was recommended by one of our members. I didn't think of it. I thought it was a good idea. So the initial timing, they call it the 48-hour rule, but you have to get in within 48 hours. We commented that there are times when it might be acceptable to contact the physician, especially if this came from the community or from the physician. Does this really have to be seen in 48 hours? So between a communication between the home health agency, excuse me, and the referring physician, we asked them to make an allowance for that. These are just a quick few things. Again, these agencies came up with these 10-day to copy your medical record for patients. It used to be that during COVID. We asked them to reinstate it. It's 4 days now. And, again, how much staff do you have? That's kind of a quick turnaround sometimes, especially even if it's on a Friday. Cost reporting redundancy between Medicare and Medicaid, asking them to have the Medicare and Medicaid try to have it's only one form has to be reported. Excuse me. The non-discrimination rule, I was thinking about this. This came out last year with some basics that I think everyone took care of, documenting that you had non-discrimination, and there were a few key points you had to do last year. But the majority of it is supposed to be effective in July of this year. So I commented that this was very burdensome and kind of was over the top. So we'll see. I asked them to rescind the acceptance of service policy. We all have policies already. And my concern with this acceptance of service policy, it kind of dictates your process. You're doing all of these processes, and I can see it being an issue for a surveyor to easily cite someone on. So we commented that that was a redundancy. And then, of course, we put in comments for the 80-20 rule. I think there was some other, like when I was thinking about it last night, I didn't have the document in front of me, but there are quite a few. And as I said, it's 13 pages, and I hope you get a chance to read it today. Oh, any questions? Okay. Just a few quick things. I want to make sure people don't miss this. There's so much information that comes out. The Medicare cost report for 2024 is due on June 2nd. That's coming around sooner than later. We recommend early submission for you. You don't want to, you need to avoid a suspension of your Medicare payments, which will happen if you submit late. And if you did have a payment suspension, hopefully no one does, it is released once that cost report is submitted and accepted. And the acceptance review process takes up to 30 days. I didn't realize that. I was just read that recently. And they're reviewed on a first in, first out basis. If you want to check the status of your cost report, if you have it in already, you can do it during the Medicare EF dashboard. Okay. I put this in because so many agencies have been called me recently with problems with their expedited appeal process. Our BFCCQIO is now Accentra. It used to be Kepro. Before that, it was Levanta. When it was Levanta, I was doing this back then myself. It was a very easy process, and the patient knew in 72 hours. That hasn't happened since Levanta took over, and it certainly isn't happening with Accentra now. It almost seems like there is no such thing as a 72-hour appeal process. They are having, I just saw this come across on one of the newsletters from Accentra. They're having an introduction to BF, to the QIO program. And they said they're going to talk about expedited appeals, immediate advocacy, complaints. I am registered. I want to listen. I mentioned this to our quality people as well. There's the registration. It's May 21st at 2 p.m. I think it's only an hour. I know some agencies will receive documentation that said that the patient could you need to have certification from the doctor that the services are still needed. That's been, but it says any doctor. It doesn't have to be the doctor who signed your orders, who took care of the plan of care, who's the doctor who told you to discharge. If a patient can get any doctor to certify they still need home health, then Accentra will go forward with the appeal. I did look up the regulation, and that's the way it read. And then I contacted Mary Carr, who is the National Alliance for Home Care. She is the Vice President of Regulatory, and she told me the same thing, and that it doesn't seem to be a 72-hour process anymore. So just want to keep monitoring if you're still having problems. I don't know if this is going to become an issue that we might have to go forward to CMS with this. Any questions? Okay. The National Government Service, I'm wondering about targeted probe and educate audits, if they're still ongoing. I haven't heard, I know a couple of agencies just passed their first round, so they're all set. So if you don't pass the first round, as you know, you go into a second round. And then if you have a high claims error rate, then you go into a third round. And if you don't pass your third round, basically you're in trouble. But I don't know, has anyone had any target and probe and educate? I don't even know what the focus is anymore. The last I heard was they look at homebound and medical necessity. And I think that's really it. I wanted to bring this to your attention. So I'm not familiar with this, and maybe you folks already know, but there is a date of May 27th on this. So National Government Service will no longer accept any inquiries that you do through the Postal Service. Now, maybe you don't do it through the Postal Service, you probably don't, but I also noticed they won't do any fax, no fax lines at all. So there is something called the Medicare correspondence request form that people might have used. They are no longer going to accept that as of May 27th. And so all your inquiries have to go through their internet portal, which is called NGS Connects. You might be all doing it already, but I just wanted to pass it on. I wasn't sure. If you're not enrolled or you're not sure about it and you want to ask someone in your office, there is the link to NGS Connects, the user guide. And there's different user guides for whether you're home health or a different provider. So that part A is for home health and hospice. Well, I'm zipping along through here. Oh, I do have a question. Oh, someone's going through TPE now. Kathleen, I don't know if you want to unmute your line and tell us what the focus is, and did you get the 40 charts? We haven't heard from anyone in a while.
Focus is absolutely on the homebound status. And we actually did not do well. Got some crazy responses from NGS, from the reviewers. Although two of mine, although the patient exhibits a considerable taxing effort to leave the home, they can do so with assist, not homebound. I'm like, what? I said, that's not the reg. I mean, I sent copies of the reg. I said, it doesn't say if I have help, I can leave the home. It's a taxing effort to leave the home. I said, by your definition, nobody's homebound. I can be laying in a stretcher. And if I have to go to a doctor's appointment and the ambulance comes and two people roll me in, I said, what taxing effort is it on me? I lost my first round appeal. I lost the second round appeal, and we actually brought it to court. We won
wow.
6 out of 7 in court. We're still awaiting the 7th decision. And then I just got a call the other day saying, okay, you're going to the next round. I said, no, I'm not. I said, we
Wow.
won in court. I said, I am over 90% pass at this point, and I am not going to another round. And they said, oh, that doesn't matter to us that you appealed at court. I said, oh, no, it does. The communication is awful. You'll just get, well, we're very busy. Someone will call you back. So the reviewer I spoke to, who was calling me to let me know, check NGS, I was going to the next round. I said, no, I'm not. I'm like,
Kathleen, what was this? I'm sorry, what was your reviewer's name? Do you remember?
I actually have it in my email. Let me, oh, do I actually have it in my phone call? Let me check my email. She actually, when I said to her, I am not going to another round, I followed the appeal process and we won in court. You are wrong, we were right. She said, I don't know what to do with this. I'll have my head reviewer call you. And I have yet to receive a phone call.
Wow.
Something similar happened to me a few years ago where I got them to, they said something wasn't signed, or I don't even remember what the case was, but during our education, the person reviewing them said, well, actually, no, it's here. So I guess they passed it or they accepted it, but since it was still marked down as not, that it didn't go through or that they didn't accept it, we went into the next round.
Yeah, I had, and just so you're aware, the whole electronic signature, but the date's not.
Yes, that's exactly
there.
what it was.
We took that to court and we won. That is not the reg. You do not need to have it. So we actually, we probably spent more on the lawyer than we did just giving back the money, but it was principal.
Yeah.
So the reviewer is Brittany Bolio.
What is it?
Brittany Bolio, Beaulieu. And she emailed me on the 5th, wanted to let me know that they're reaching out to me because they're quite busy. You know, they're quite busy. And that someone would, her her head reviewer would be contacting me. I've
Oh.
left 2 messages since. I've had no communication. On a happier note, they told me back on the 5th that I could check my NGS Connect site for my next round and nothing's there, so.
Oh, well, that's good. What court did you take him to, Kathleen?
You know what, Paul Shaw,
Oh, yeah, he did it for you?
where do we go? You know, I could go on my emails and get that to
No,
you.
no, no, no. That's okay. That's okay. I just, you know, if you have any issue with it, well, you have Paul Shaw, but I was gonna say, you know, you could always call us if you ended up going into the 3rd round, but I'm sure Paul Shaw will take care of it for you.
Yeah.
Well,
Well,
thank you.
unfortunately, the follow-up from that, we're like, are we getting our money back? Anything? I am my accountant trying to trace whether we got our money back, or it's not an easy process.
Wow.
I'm like, I want my money back.
Yeah, yeah. Well, especially you
And
don't want to go into a 3rd round, that's for
I'm like, I
sure.
want a big old pass.
Yeah,
But the reviewer itself, and I originally called when some of these came back, I just called and said, hey, this is crazy. Are you actually looking at what your reviewer is putting on here? They demonstrate a considerable taxing effort to leave the home, but they're not homebound. I said, you can't do that. And she said, oh, I'll look into it. And then they just came back with, no, we're gonna uphold it. I said, but you're contradicting yourself.
yeah,
I
yeah.
said, targeted probe. I said, this is definitely a target.
Wow, that's terrible. Well, keep me
Yeah, we
posted.
had 2 like that. We had 2
Yeah.
like that, one for the electronic signature date, which was actually overturned on the 3rd level appeal. And they said, no, you don't need to have that. That's not the reg. Um, yeah, it's been an
Okay.
interesting process. It's gone on for months and months and months.
Wow.
Um, we're
Well, I
still
thought
waiting
they
to
were
hear
quiet
back
and
on our final decision from our last one. We appealed every single one of them. I mean, I was getting yelled at, and I'm like, these are the best charts I have ever sent out of these buildings. Like, we got a new Medicare reviewer, and I did the probe, and I'm sending it out going, wow, that chart looks great. Wow, I'm
wow,
13 years with this company, and I said to the owner, I said, those were the best charts I have ever sent out of this building. I don't even know what to say on, their responses.
wow. Well, if anyone else is having a problem like this and we find out it's the same, that's why I asked you what the name was, Kathleen.
Mhm.
You know, sometimes if it's a new reviewer, we could bring it to the attention of NGS, so, you know, we don't have issues again. But keep me posted, Kathleen. Thank you for telling us that.
Yeah, no problem.
Anybody else? Karen, you had targeted probe and educate too?
Yeah, I'm still in it, yep.
Yeah, are you all done?
No, 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 they're still pulling charts. I think I'm on chart 21.
Oh, wow. Okay. And it's homebound as well?
Homebound as well, yep. They denied one where a 97-year-old patient needed a walker and was on oxygen, CHF, like shortness of breath. They are looking for documentation that says, well, patient is shortness of breath at 10 steps. It wasn't detailed enough.
Oh, my goodness. You know, I hate to say it, but if it's in your chart, I don't want to say hate to say it, we should say it. It doesn't have to like say homebound because da 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 da. Throughout your chat, if the nurse or clinician is writing, you know, patient short of breath dressing today, or little things like that, they're supposed to accept that as the overall picture of being homebound. Um, that's terrible. It really is. Did you have the same reviewer, Karen? Was it Brittany?
I have to go back and look. I don't remember the name. I'm gonna have to go back and look.
Okay.
We're also in one for hospice for Alzheimer's.
You have 2 going on at the same time?
Yes,
My goodness, I didn't think they were supposed to do that.
it's a different, since they're saying it's a different NPI, I don't know.
Oh, wow. Is that what they're saying? Because it's different MPI. You know what? I think I looked into that for someone else before.
I think it was me.
Maybe.
Yeah.
Oh my goodness. Well, keep us posted. Yeah, and unfortunately with, you know, this is on claims error rate. So the amount of the claim, if it was a claim for a large amount, that really can be detrimental with the percentages. And you said for hospice, what was the focus? Did you say, Karen? No, can't hear you.
Sorry about that. I didn't hear you.
Yeah, Karen, what was the focus for the TPE on hospice?
Dementia, well, Alzheimer's,
Okay, all right,
Alzheimer's, and yeah, I think that's it.
okay, okay,
But for that one, they're actually looking at, I've had to like number the pages, like where they're going to find what, like provide like almost like a table of contents.
yeah,
Because they were saying that the CTI wasn't there, like both physician signatures. And then I had one where they tried to deny it because the patient went from a private home to a nursing home, and the doctor changed. The problem with that, oh no, it was the other way around. They went from the nursing home to the home, and the primary caregiver wouldn't tell us like who the PCP was. And that's documented throughout the chart. But all of our orders had been signed by our medical director. So, I mean,
oh, wow,
yeah.
pretty picky. Melanie, you have hospice TPE too. Is your focus the same?
Yeah, it's well they're focusing on patients who are in the skilled nursing facilities. So I'm seeing a lot of different diags, but it just so happens to be the majority of them are dementia for sure.
Oh, okay, but they're
But
in skilled
yeah,
facilities, huh?
yep.
Okay, oh, interesting. Write that one down.
And yeah, they said they'll be asking for 20 to 40 records. I've submitted 17 so far.
Wow.
Yeah, still in the beginning stages of it.
Okay, well, keep us posted.
Will do. And
Thank
we actually we did complete a round of home health TPE as well. This goes back to December. But we were able to pass round one, and that focus was they were really looking at patients with the after code, that Z code for aftercare of orthopedic surgery. And then of
That's pretty
course
standard for skill, but
And you know, of course, you know, they were also looking at, you know, skill, homebound, but yeah, everybody had an aftercare for orthopedic surgery as their primary diagnosis for that.
wow. Thank you.
You're welcome.
I mean, give these patients a break after surgery. You're homebound for a little while anyway. Wow. Anyone else with TPE, whether for home health or hospice? Okay. I just want to let you know that the PEPA reports and the, I always forget this, the billing reports, comparative billing reports. As you know, they paused last year, and I know a lot of agencies look at that, you know, for their quality and how their billing practices in relation to other agencies. So CMS said it was going to be out early this year, but now this summer of 2025, it said will be the next release. So I'm not sure what it's going to look like. I did go to the website, nothing's there. This came across from MLN Matters, that I was even informed of this. I didn't realize it. And then you can monitor your updates on that link. Let me see. Let me see. I can't. There it goes. Oops. What's happening here? I'm supposed to be going the other way. I'm sorry. There we go. So MassHealth update, the cost reports, I think we put this in update last year as well, last week. The cost reports a delay. I was on a stakeholders meeting yesterday and they said mid to late May. Well, it's mid-May right now, so I just put late May. We still don't know. As soon as we find out, we'll definitely send out an email right away. MassHealth also pointed out fiscal soundness is not only for the home health agencies, but also if you have continuous skilled nursing. So I know some agencies do both. They need two, one for HHA and one for CSN. They are due on May 31st. If you fail to complete it, they are going to result in sanctions. I think last year and the year before, they were pretty lenient. From the stakeholders meeting, it seemed that they'll be less lenient. They didn't say exactly. And I don't know what the sanction is for not completing that type of document. I know if it's things in the chart, every missed information or lacking something is $100 for each one, but I'm not sure for fiscal attestation. I'll have to find out. I wanted to keep folks updated on EVV as well. So today at 2, and unfortunately I can't watch this one, but this is visit maintenance. And this one, and I didn't realize this when I watched the other two. They had 3 sessions and they were all directed towards SAN data. So if you have an alt VVV, these aren't for you. And MassHealth will be doing more town halls in June for the alt AVV agencies. Yes, it's different. And then MassHealth also said in the stakeholders meeting yesterday that they're going to be issuing a compliance plan that will provide guidance on the required thresholds for compliance with EVV. So meaning, that they don't expect 100% compliance, but are you 60%, 70%? They didn't say what percentage of compliance it would be, but they're, I think within the next month or so, the information on that will come out. And it will be issued by mass.gov under the EVV section. So we'll keep our eye out on that. As I said, it is not posted yet. Anybody have any other questions? Just for the next slide. The recordings for the other 2 SAN data, if you missed it, it was an EVV systems overview. It was very basic. It was kind of repeat if you've heard it before. I don't think there's anything new there. And then the data entry, but again, that is for the SAN data, not the alt EVV. And I literally copied this first section. It says available here from the agenda from MassHealth stakeholders meeting. When I clicked on that this morning, those recordings are not there yet. So I will contact MassHealth. The recordings from last year are there, but not this year. And then they gave us all these contact and resources. So I thought I would just list this because I know some of the website addresses changed. So I'm not sure if folks have them, but these are the correct ones for the detailed instructions for onboarding. I'm sorry, you're all there now. The recordings and materials, Q&A, whatnot. So this is just a reference page for you. Anybody have any questions about EVV? Maybe you can put it in the chat. If you do have outstanding tickets, you've been asking and asking and asking, and they're outstanding for like weeks. MassHealth and you've been trying to contact and get information, MassHealth is looking at those ticket numbers and trying to help agencies work through it. So if that's happening to you, you can shoot me an email. They brought this up also yesterday. And I'm not really 100% familiar with this. I remember it basically. So with COVID, they suspended the need to have the members who are enrolled either in a PCC plan or a primary care ACO. They needed a referral from their PCP of record to be put in the MMIS system. And I guess you guys have been doing it all along, but once COVID hit, you didn't have to do it anymore. And actually an agency about, I can remember at least a year or two ago, asked me, do we need to start this up again? And I asked MassHealth and they said, no. Well, now you do. So it's beginning August 1st. The referrals will be required for your claims and billing. If they're not there, they're not going to pay the claim. And I asked for some more information on the phone call because I wasn't familiar with this. And what I need to have clarified is I'm assuming this will be for new starts of care. As of what date? I don't know. There's not much information here. But I just wanted to bring it to your attention. So if you see it, sometimes there's so much information and it passes by quickly, you might miss it. So I just wanted to bring that to your attention. And I will, once I hear, I will send out an email or put it in update. For quality folks, I'm sure you already know this, but I like to pass it on. The home health quality reporting preview reports had been corrected. There was an error for 16% of the home health agencies. So it's a bit of an error. It is corrected now in the iKey system. So now your preview period is extended through May 21st. Kind of curious if it was any Massachusetts agencies, but 16%. Oops, sorry. I thought that was quite a bit. A couple of hospice regulatory updates, and POLST isn't just for hospice. It's, for any agency that does do pronouncements or palliative care with doing pronouncements. The POLST, there is going to be an update on May 20th. Priscilla Ross, she is the program manager, or director, I should say. And Priscilla, actually, I've worked with her before. She was a director in a home health agency. So she knows that we need education when the time comes. So if you want to register, click here. It really is probably not going into effect until 2026, I think. So I will pay attention to that. But if folks are interested, that's when we get rid of the MOLST, the Massachusetts Life Sustaining Treatment. The order for life sustaining treatment now is going to be portable and it's going to be electronic. So your healthcare personnel for the flu and COVID-19 vaccines are due 5/15 for hospice. I should have put hospice there. Oh, it's hospice regulatory update, but that's for hospice. You need to submit that data to this link. And this is an annual reporting requirement. This isn't something new. It's per usual, but it is due tomorrow. So I don't know if folks missed this. I mean, in quality or in coding, there was an update that came by my desk for hospice principal diagnosing codes reporting, and it was in a change request through MLN Matters, Medicare Learning Network, and the change request is 13882. That will take you to it. And it's just an update of unacceptable principal diagnoses. I'm assuming you have them and you know them all. I'm not familiar with them, so I couldn't really tell you what's different. What it says in section 30.3, the updated guidance for non-reportable principal diagnosis codes. In 40.2, it's clarification of liability and claims denial. And then section 50 just adds related conditions to align with the way the Federal Register was listed. So I'm not sure if that's a big deal or not for folks. And that's it. We can open this up to Q&As. I did want to remind folks that tomorrow, and I don't think it's too late, although I don't know how many seats are left, we are having our emergency preparedness tabletop exercise tomorrow in Needham at 9 o'clock. I will be there. I hope I'll see some of you folks there. Barbara Citarella, our national expert for home care and hospice, is doing it. And she did a great job last year. We asked her to do it something different. So she did, and folks who attend, they will receive the information, so then they can repeat the PowerPoint, the tabletop at their agency for their emergency preparedness requirement, if you needed it this year for tabletop. And then I don't want folks to miss, I think it's going to be good on June 12th. We are having a QI and compliance conference. We haven't had one since pre-COVID. We used to get a really good turnout. It is going to be in Medway, Mass. MassHealth has confirmed they are going to speak and talk about all their regulations. National Government Service, they just declined. And they declined, and I was surprised. I thought they would do it for us. They declined because of travel expense. Their travel expense is suspended or stopped, or I don't know how they worded it, I forget. And they're not from around here. I think they're either in New York or upper Maine, so there would be travel expense, and they're not allowed to do that. And we're going to hear from a 5-star agency. And we're hearing from Symmetry. Melissa Gordon is going to speak to some basic compliance, the risks. We had a conference call with her yesterday to kind of tailor it to what your needs will be. And then we just haven't confirmed the other speaker will be for audits and denials and you know, kind of how to avoid that. So it's from, Cynthia can correct me, but off the top of my head, I think it's 9 to 1, and I'm trying to get CEUs, not only for nursing, but for the therapists.
Colleen, it's Suzanne from
Suzanne.
MBNA and Husband High. Just a question on the NGS. What, since they can't make it, could they come by Zoom? Could they, it'd be nice to be able to ask them questions and, like.
Yeah, I did ask that. They can't now because like of time constraints, but we didn't really have the electronic ability to do that when we're in a, you know what I mean? And we didn't, I think if we had asked them or they got back to us a little sooner, we might have been able to finagle that, but they didn't even offer that to us, to be honest with you, but I did think of it. But next time, we'll probably have this again next year. I did really want to get them, especially after this conversation we're having with TPE. But, maybe I can ask them if they could do another one for us, like maybe in the spring, just a webinar type of thing. Well, thank you for that, Suzanne. I'll broach that with them. Anybody else? Oh, I got something in the chat. Someone replied about the basic audit plan. Okay. Oh. Yeah, and so as we would just discuss, I'll try to get something from NGS, but not at this point. And apparently we have to give them a huge lead time because their calendars are very busy, I hear. So I'll contact them again. And I'll try for the fall. And I'm assuming you want to hear about TPE, regular audits, all of that. Okay. That's good in light of what I just heard too. And so we'll contact them again. Anybody else before I give you 10 minutes back?
I have one more question, actually. So just because this is always fine, I always find this very confusing. So this is home health aid. So home health aid certification. I know we have the Medicare reg that we need to follow for home health aid certification, but we used to be able to use nursing students to be a home health aide. And so now I'm hearing that we can't do that. Of course, they had to have certain classes
Yeah,
or
2
whatever, you know.
years. Yeah, after
And
2
but I
years.
think it might be a Massachusetts, something happened in Massachusetts that's saying that we cannot use, they have to, a nursing student has to go through a home health aide training certification class and the exam in order to be a
That's
home health aide.
That's what I heard. Someone else asked me that, and I really looked on the internet last
I
night.
can't find anything about this.
I can find it that it's allowed, but that
Oh.
was from 2024.
Can you send that to me? Because I'm just like trying to find something
Yeah.
that Massachusetts speaks to concerning
Yeah.
nursing students.
I think what it said was, well, you know how when you Google something and then it gives you that and explains and then
The
it gives you
AI,
something.
thing, yeah. Mm.
Yeah, it actually said, the first 2 years after education with the curriculum, it's good enough to be a home health aide, but I'll find that for you.
Yeah, because we're hearing that
Yeah, that's
from
too
different
bad. 'Cause
people yes.
yeah. I'm just writing it down so I don't forget.
Yeah, I want to, as the regulatory person, I want to see that reg. Like I want to see what it actually
I've
says
looked
in
at-
Massachusetts. So that,
Yeah, I couldn't find it, so I guess until you can't, well, I'll try to find, I don't know if I actually really want to ask the Board of Nursing.
I think that's where it came from. And
Oh,
that's
okay.
where,
Yeah,
so again, is that a recommendation? Just like the whole, nurse practitioners can invoke
Well-
healthcare proxies. Is this just a recommendation or is this true? And, I feel like this is it's a little messy to me in Massachusetts. And I can find so many different things for private care aides and, but where's the home health aid?
yeah. I
Requirements
think
in
it probably might say home health aide CNA, but still it's the same.
I mean, it refers you back to Medicare, but which then again refers you over back to like the state program, right? Some of it, So I was just feeling like, but it wasn't really. I can't find anything about nursing students.
No, I couldn't. I found it, but not a new regulation. So I'll show you what I did find.
Okay, thank
I
you.
have a board meeting right after this, so I'll have to get it to you tomorrow.
Yeah, no, whatever. That's fine. Thank you
Okay.
so much. Or if anybody
Yeah.
else has any information they want to send to me, that'd be great.
Yeah, if anyone else knows.
Yeah.
Feel free to share. Any other question before we close? No? Okay. Well, take care, everyone. Nice to see everyone. I'll see you next month.
Thanks so much.
You're
Thank
welcome.
you.
Yeah, bye-bye.
Hey, Colleen. So,
Bye. You
yeah,
you
I'm just
recorded it.
yeah, I recorded automatically.
All right, I'll send you the PowerPoint.
Okay.
Okay,
I'm gonna end it for all. Bye.
bye.